We're now going to look at the application of non-invasive ventilation, i.e. positive pressure ventilation without the use of an endotracheal tube or a tracheostomy via either a face mask or a nasal mask to a patient. So for this we need the machine to deliver whatever form of non-invasive ventilation we are using. We need a filter to ensure that the air going to the patient's chest has relevant particles and bugs filtered out, a length of elephant tubing, and a mask, either a face mask that goes over the nose and the mouth or a nasal mask that just goes over the nose. And both these sorts of masks have a method hat that actually fixes to the patient to secure the mask. Because it is positive pressure ventilation, it needs to have a secure fit around the patient's face. Now, before you apply any form of this, you need to switch the machine on and you need to demonstrate to the patient what the flow of air feels like. You then turn the machine off, fix the mask to the patient, and then move forward. Okay. Applying the mask to the patient's face. So this is a full face mask. So the most efficient way of putting this is to place the mask over the patient's nose and mouth, put the top strap around the patient's head to make sure that that's a reasonable fit, and then clip on the two bottom straps. Now this has to be a good tight fit, but not too tight, because you don't want to create pressure sores. So it's a bit of a balancing act of fixing the Velcro straps on the head, making sure that it's comfortable, right, and that the mask is straight on the patient's face. Alright. So again, you need a good tight seal round the nose, round the mouth, and then attached to the machine. Now what's very important with the face mask is that the patient is able, or whoever's looking after the patient is able to quick release it in case they feel sick. So this sort of mask has a quick release button on the bottom, which is just been shown, yeah? Alright, and if the patient is compos mentis enough, then they can easily remove the mask should they feel sick or feel claustrophobic. So now we see a nose mask in situ, so very similar shape mask, but it just goes over the mouth, and the mouth is open and the patient can talk and drink. Okay, similar, if you look around the head, very similar mechanism for holding it in place.